Geriatric grandparents and Dr. Permashore. Thank you for joining us online. If you're anywhere near the Mill Mountain Conference Room in Tanglewood, please join us in person. Today's speakers are from our colleagues in the Department of Psychiatry, Dr. Badr, Ratnakaran, and Dr. Khalid Kiran. Dr. Ratnakaran is the Division Chief of Geriatric Psychiatry at Carilion's Center for Healthy Aging and Assistant Professor of Psychiatry at Carilion Clinic, Virginia Tech Carilion School of Medicine. He currently serves as the President of the Psychiatric Society of Virginia and the Chair of the American Psychiatric Association's Council for Geriatric Psychiatry. He has over 17 years of experience in mental health, and he works as a clinician educator. His areas of interest include geriatric psych, consultant, liaison psychiatry, climate change and mental health, social psychiatry, academic psychiatry, physician wellness, cyber psychiatry, and psychiatry in the arts and media. Dr. Khalid Kiran is a child and adolescent psychiatrist at Carilion Clinic and works as an assistant professor at Virginia Tech School of Medicine in behavioral health. She serves as the psychiatry medical student clerkship director as well. Her areas of interest include child and adolescent psychiatry, pediatric consult liaison, and neuroscience education. Please join me in welcoming our speakers today.
Hello, everybody. So we are. So today, thank you for having us. We're very excited to come and present. We're going to be talking about grandparents who are guardians of the grandchildren around the galaxy. Our agenda today is we're going to be split into two topics. So we're going to talk about the rise of grandparents involved in the care of grandchildren, outcomes, and the importance of addressing them during clinical encounters. And then we're going to talk about custodial grandparents, the challenges, their needs, and resource navigation, and the role physicians can play when they come in contact with grandparents and grandchildren. First, we're going to do a quick poll. How your experience with with grandparents. Oh, sorry. Two questions.
Yeah, it worked for me.
All anonymous. We've got a good mix of folks. Like, we've got some people who feel confident to understand and address the unique challenges in working with grand families. Some people feel neutral about it, some disagree. Nobody strongly disagrees, so that's good. Okay, nobody still strongly disagrees, but most people are kind of neutral and split between agree and disagree. Okay, and then there's one more. It should. Look at the same. Is it coming up, or do you want me to pull a QR code again? Pull a QR code.
I can see.
Appreciating and understanding limitations, custody, legal aspects, time, cognitive decline, legal limitations. I think I broke it up into each word, but what I'm understanding is understanding limitations, cognitive limitations, physical limitations, legal aspects of it. Okay. Yes, so fatigue, grandparents have kids' best interest at heart, but sometimes sometimes they're behind the times, they're still stuck in very old thought processes, resource navigation, grandparents with their own physical and financial limitations, transportation, legal issues, generation gap, cognitive decline, people who don't have legal custody and are still full-time caregivers, and understanding and appreciating their limitations. Okay. I think so those are the biggest barriers and challenges that you've identified in your work with grand families. Keeping it in mind as we move forward, because I think we'll be able to address some of that. Hopefully, you'll move from either neutral to agree or agree to strongly agree, where you have some understanding. Although it probably will take more than one grandparent to have a full appreciation. Okay, all right, I'll hand over back to Dr.
So, hi, good morning. I know my name is handful. You can call me Dr. B for ease or Badr. So, I'm a geriatric psychiatrist. I actually work next door. My clinic is like at the farther end of that psych building. It's called the Center for Healthy Aging. We are geriatric psychiatrists, geriatric medicine, and palliative care. So, we kind of like cover all of the spectrum, related not only geriatrics, but also similar issues related to medically complex conditions, Parkinson's disease, neurologic disorders, TBI, stroke, all those difficult cases. But I wouldn't say it's common, but very often we come across grandparents who are caregivers of grandchildren. And that's a burning issue nowadays. Not many people talk about it, but it's a rising problem. So I'm here to talk about from the other spectrum of the age where this is a challenge, and also thanking you to invite me coming from the other side of the age group to the pediatrics department to talk about this issue. So we'll be talking about the rise of I'll be talking about the rise of grandparents who are raising grandchildren, the outcomes and importance. And the importance of talking about this is there's a lot of misconceptions. Even when I was bringing this topic to the Council for Geriatric Psychiatry and the American Psych Association, it's the bigger organization in psychiatry. There was a misconception that what are you talking about? Poor outcomes. Everybody assumes grandparents involved in grandchildren have good outcomes and there's meaningfulness, and you will hear those stories. And then you dig a little deeper, and then you will hear about cases about grandparents struggling to raise grandchildren. The other part of the story is you probably will be seeing the tip of the iceberg, because for me, from a geriatric psychiatric perspective, many of these grandparents might not be coming to see me. They're spending more time taking care of their grandchildren. So we're missing those cases most likely too. And also figuring out how to help them when they're taking care of their grandchildren. So I don't have any conflicts of interest, nor I'll be talking about any off-label use of medicines. And my goal is to talk about some of the epidemiology of grandparents raising grandchildren, and possibly recommending some ideas about when you have clinical encounters and how to address grandparents taking care of grandchildren. And if you didn't know, we just passed the day, September 10th is considered National Grandparents' Day. It was declared by President Jimmy Carter is still alive, and grandparent, great-grandparent, and he declared this in 1978. Some of the numbers, in 2022, the American Community Survey, one-year estimate said there are 6.5 million American grandparents living with their grandchildren. Now, this is a significant number, and that's why I said we assume a lot of times that their grandparents might be living alone, and it's not multi-generational families, it's two-generation households. Many of these grandparents are females, 2/3 of them are females, close to 1/3 of them are never married, divorced or widowed, and close to half of them are actually working. So think about this group that is also still in the workforce, having a lot of physical disabilities, medical comorbidities. So think about, they might not be directly taking care of their grandchildren, but think about that additional burden in the household, somebody who might be still working, having their own needs too. The other important part to think about this number is close to one third of them are foreign born. So most likely they're immigrants, and close to a quarter of them don't speak English really well, and they might struggle getting out if they're actually getting out for the needs for their grandchildren. They might struggle navigating resources or needs for the grandchildren too, in case the parent is sick or something. And close to a quarter of them would have some kind of a disability, physical or mental disability too, including dementia. And close to 12% have income that is below poverty level, and same number would be a household responsible for a grandchild with no parent or present over there. In terms of race, majority of the grandparents are going to be white, but we have to take into consideration about minorities. When you look at proportion of actual grandparents taking care of grandchildren, actual responsibility, the minorities have a higher proportion taking care of the grandchildren, especially indigenous population, American Indians or Alaska Natives, and even Black or African American population has close to 40% are grandparents taking care of these grandchildren with some responsibility compared to other races. And there's many reasons for this. A lot of this is cultural expectations that at some point of time the grandparents are expected to take some role in taking care of the grandchildren, and this is a lot of times over generations a tradition, so reciprocation. Oh, my grandmother took care of me, so it's my role to take. I have some expectations. I expect myself to take care of my grandchildren, so it's a little bit of a paying forward. If you don't do, there'll be some guilt or shame related to it. A lot of times there might be a death of the parent in the family, and so there's some grief and they take over the role automatically. And if they don't, they fear they'll be judged by their family, friends, or these are tight-knit groups. So a lot of very religious people, a lot of times they'll be shamed if they don't take over that responsibility. Among Native Americans, in many American Indian tribes, the grandmothers are considered sacred, sometimes matriarchal, and generally assume parental responsibilities, and parents are not available, like they're going to work or they have to leave this place to work. And close to 40.5 American Indians or Alaska Natives are responsible for care for the grandchild, and they're the highest of all racial and ethnic groups. Second comes Black and African Americans, and historically these are people who are taking care of grandchildren during when the parents were enslaved or working, or when they traveled for work, or even during the crack cocaine epidemic era, when a lot of the parents passed away or were not present, they had to take care of grandchildren. Hispanic American families, there's a lot of importance in joint families or extended family values. Again here, grandmothers are a lot of times seen as matriarchs in the family, and they might step into and even be the important voice in the caretaking of the grandchildren. And they might also dictate some of the decisions too. And close to a quarter of the Hispanic grandparents valuing grandchildren had some responsibilities. Non-Hispanic white or European American families are next in line in terms of proportions. And traditionally, they were involved in grandparenting more during the height of the European migration to the US. Not so much right now, but they're still very much involved in grandparenting. Next comes Asian Americans. These are the least likely ethnic group to be responsible for raising grandchildren, but we still do see them taking care of grandchildren, especially Asian population from East Asia or Indian population. I still see people from Middle East also taking a role in taking care of their grandchildren too. But numbers-wise, it's the least likely ethnic group to be responsible for raising grandchildren. But the problem is, like I mentioned, a good number of these grandparents who are actually taking care of grandchildren are actually working. And these numbers are from 2019 US Census data of 1.3 million grandparents are actually in the labor force. So that's a concerning part, where these are people who are through the later phase of their life, not very productive, but they're toiling really hard to make some means, additional income, and find ways to raise the grandchildren too. So there's a lot of additional stress when they should be slowing down and taking care of themselves. And two particular crises is important for this. One is the COVID-19 pandemic. Recently, a lot of parents passed away, leaving their grandchildren to their grandparents, and also the ongoing opioid epidemic. And that's one of the biggest things we see in this region. A lot of parents have passed away or lost custody of the children. The grandparents take over parenting roles. And according to the Hill study, nearly 167,000 US children have lost a parent or caregiver during the pandemic, and this is just a small part of the number. There might be more. And in terms of substance use, parents with opioid use disorder increased by 30% between 2002 and 2017. This is older numbers, and close to 200% of children were living with an adult who misuses heroin. And this number is a higher risk for that parent to lose custody of their child, where the grandparent will take over custody of the parenting roles. In terms of type of grandparenting, there's a non-formal caregiving role where they are there. They supplement caregiving. They're not actually the formal caregivers. They help around. They're around to look after them and play with them and give them some company and give some advice. They might have equal roles with the parents. The parents might go to work and the grandparent might take the children to school, sports activities and things like that, and also babysit the child too at times, but they're not still fully legally responsible. And you have the bigger problem of custodial grandparentship, where the grandparent is the actual legal guardian of the grandchild. They are the ones who have to make the decision for the child and provide for the child, and this is where the challenging part comes. So custodial grandparents, I'm define it. There's a term that's usually used in Asian population called skip generation families. You might see that definition come up. These are families where the parent might have left the village or town to work in a bigger city, and the grandparents or the greater grandparent might be taking over parenting roles of the grandchild in the house. And the parent might be absent for a longer period of time. In the American context, this could be also where a parent is incarcerated or deployed in the military, things like that. Definitely know the transgeneration effects. If there are trauma, stress in the grandparents, genetic factors could influence lineage down the line through DNA methylation, things like that. The Danish famine study, many of the studies have shown transgenerational effects can be passed on to grandchildren too, including smoking. That has shown that grandparents were smokers. All of those changes can be passed down the lineage. There's a lot of reasons for grandparental stress. Some of the theories of social exchange theory is the most commonly accepted theory, where you are expected to take care of the child, but the actual resources are not available, and that will not permit them to succeed in the role. There'll be some strains in the roles where the grandparent is feeling frustrated, angry that they're not able to meet the expectations of their role, and there's depletion of resources. It's the feminist theory where a lot of times these grandparents are grandmothers, and the grandmothers, because of being a female, are expected to be the take over the role of parenting this child rather than the grandfather. So there's a feminist theory related to it too. There's the ecological system theory where if you have a very conducive, supportive environment, the grandparents might thrive to take care of the child. But a lot of times, the reason why the grandparents had to take care of the child is due to negative factors. The parents are using substances, might have lost custody, they might belong to low socioeconomic status. Everything is against them, and the grandparents are in a lot of stress. And in a problematic environment, they find it difficult to raise the grandchild. And social efficacy theory is where if the grandparent is confident enough and has a positive outlook that I can take care of the grandchild, a lot of times they don't feel very stressful. Or a lot of times the grandparent is feeling, I'm not up to it. I have a lot of arthritis, pain, memory is not great. They might feel dejected, feel challenged about taking care of the child, and they will have a lot of negative social emotional issues, especially in relationships. And family adaptation theory is similar to ecological theory, where when there is a conflict or an issue in the family members adapt to the situation. Right? If somebody gets sick, roles interchange in between. The mother's sick, grandparent comes in, or father is away, the mother and grandparents take over the roles. But if one of the family members is not cooperative or absent, that void is difficult to fill, and the grandparents might feel very challenged about taking care of the grandchild. One example I have is where a grandparent is taking care of the grandchild when the mother's out to work, but the mother's not very cooperative in providing resources or understanding the challenges of the grandmother taking care. Grandchild, like, it takes a lot of time to let the child go to school, a lot of effort taken for doctor visits and sports activities, not getting enough financial help for it. So a lot of conflicts like that can cause stress. And symbolic interaction theory is more about how does the grandparent think about taking care of the grandchild? Do they find it meaningful? Do they find closeness to relationship with the grandchild? Is it fulfilling for them? If they don't find it meaningful, they don't want to do it. They might not feel any importance in taking care of the grandchild, and it's kind of like a burden put on them, and they feel stressed by it. So outcome-wise, children raised significantly by grandparents are more likely to have behavior problems, but this can be negated by relationship closeness. If the grandparent is very close to the grandchild, it's less likely the grandchild might have emotional symptoms, and this is where probably we'll be seeing cases. And grandparent-grandchild relationship conflicts, if there's a lot of issues happening between them. One example I can give is where a grandmother disagreed the granddaughter reading Harry Potter books because the grandmother thought the Harry Potter books were witchcraftry. So as a provider itself, it's also a conflict with you too. How do you talk about those misconceptions is an issue here. So that will put the higher odds of conflicts between the grandparent and the grandchild and cause emotional symptoms. This is a very common thing, especially children with disabilities, where grandparents will be very highly involved. They'll be the first people to accept the disability of the child and develop positive views of the conditions. The problem is, a lot of times they might have unrealistic expectations, and this is sometimes you might see the grandparents say, everything will be better, I hope my autistic child will be able to speak very well, interact very well. So they'll have unrealistic expectations, and at that point, the parents might be willing to accept doctor's recommendations, but the grandparents will be questioning the diagnosis, treatment, and everything, and they'll be sometimes overdoing, looking in the internet, finding alternative treatments more than the parents for their grandchild. So it might challenge your choices too. Because of this risk, stress, grandparents have poor outcomes for taking care of grandchildren there. So think about homeostasis disruption, increased cortisol in the body, so all sorts of issues like diabetes, hypertension, insomnia, depression, they're more prevalent. Isolation is more prevalent if they are significantly taking care of grandchildren. They don't go to church, they don't take care of themselves, they're more involved in the grandchild, they don't look after them. And grandparents, especially custodial grandparents, have a belief that other parents so like in a school system, if they are the grandparents are the main guardians of the child, and they go to a parent-teacher meeting, they feel they're not heard, their other parents don't understand their difficulties in raising the grandchild, and they might feel isolated in that situation too. As per the Consumer Expenditure Survey in 1996-2015, when compared to two-generation households, multi-generational households tend to spend more on education rather than childcare, and this is because the grandparents will be involved in childcare. So the family can earn a lot more money on education. Sometimes these children have better educational outcomes. This is kind of like an adaptive strategy a lot of times in multi-generational families too. And this is also important in case where if the parents have to take a break for work, the grandparents can take over. They don't have to pay for childcare, find a daycare center, things like that. Parents can invest more in hobbies and educational activities and save on healthcare costs sometimes too. But the National Survey of Children's Health from 2016 to 19 found when compared to children in parent households, in places where the grandparents were grandparent the child, a lot of times due to misconceptions, they might overfeel the child, they might provide extra rich nutrition. It leads to poor health outcomes like all dental problems, overweight, obesity. There can be, like I mentioned, emotional problems, behavior problems, ADHD, depression. This can be a lot of factors based on how they took over responsibility of the grandchild. And because a lot of times the grandparents will think like, I'll try my best to take care of the grandchild. I may not take them to the doctor. I might not have the energy to go to the doctor. I might have to work and I'm not able to take the child to the doctor. So they might have decreased levels of healthcare utilization, and this kind of groups tend to have higher cardiometabolic health risk factors like increased lipids, and a lot of adverse childhood experiences can happen in these households. Children in two-parent households are most likely to excel academically than those exclusively raised by grandparents or single parents. But the thing is, if the relationship is good, grandparent-grandchild relationship is good, they tend to have better emotional outcomes. And grandparents who are taking care of grandchildren tend to feel less lonely than if they were exclusively taking care of their spouses too. The other interesting part is grandparents, which I see in my clinic, where a lot of grandparents say my grandchild taught me how to use Instagram and Facebook. So they tend to make them very technologically savvy. And then because they are invested in the grandchild, the children, they tend to listen to their grandchildren more with more enthusiasm and interest. So they become more technologically savvy. But the sad part is, if this is one area I struggle in my clinic too. If their grandchild passes away, the grief is very profound. They feel at that part of life, the grandchild is a light in their life, and they don't have any other meaning. You lose that light, they feel very depressed, sad. A lot of PTSD if they were present during the time of death. They have good trouble focusing on their jobs too. Gender-wise, studies say both men and women found grandparenting is one of the best things they had because they witnessed the growth. Because at that point of life, it gives them a lot of meaning. Eric Erickson's phase of life at that point is imparting wisdom to the grandchildren. So that's what they're at. And more likely, grandmothers are more likely to live and provide primary care for grandchildren. But studies say the satisfaction about that can be mixed at times too. Employment factors, retired grandfathers free of childcare obligations had lesser depressive symptoms. But on the other side, grandmothers who were actually working found they had better mental health outcomes compared to retired grandmothers. So what can you do when you have a grandchild coming with a grandparent who is caregiving? One big thing you have to look for is any signs of abuse, especially custodial grandparents, a lot of stress, a lot of emotional conflicts. That could be physical abuse, sexual abuse too, which I had to report a couple of times. There could be concerns of nutritional development, physical problems in the child, which needs to be addressed, and this is where you might have to address outdated parenting beliefs and misconceptions. Grandparents, pediatricians-wise, you probably don't need to directly address it, but look out for any physical mental health problems that could be a barrier to the care to the grandchild. You might have to talk about it, asking to find more help. Roanoke is little low on resources, but I found a lot of church groups would have support systems for grandparents taking care of grandchildren. There's some online resources that Dr. Khalid will talk about it. Child protective services, adult protective services can also, they're not necessarily punishment, they can help finding resources too for these grandparents too. But very important is to clarify the legal status of the child. Who's the actual guardian in this situation? A lot of times it's still in the process, not clear. And how much is involvement of the biological parent and the grandchild? The grandparent might be having the legal custody, but the parent might be the problem here. They'll be causing a lot of conflicts. And the grandparent might be very ambivalent about making decisions at times too, and that's something you need to clarify. The grandparent will have to make the decision of the parent for the best interest of the child. So those are some things to think about. So I hand over next session to Dr. Khalid.
Hello again. I'm going to talk about custodial grandparents. So like Dr. Ratnakaran talked about, this is a subset of grandparents. I also have no financial disclosure or conflict of interests. I'm going to talk about, I'm going to describe the challenges faced by custodial grandparents in their care of the grandchildren, identify resources that may be available and are evidence-based to assist custodial grandparents, and then just the role physicians can play in helping them navigate these challenges, and resources. So custodial grandparents, like Dr. Ratnakaran talked about, is a subset of how grandparents become involved in the care of grandchildren. So it's a subset of kinship caregivers. But the difference between them, like Dr. Ratnakaran said, is that they have legal responsibility. So they're the legal custodians. They have legal guardian and custody of the children. And then again, the amount of caregiving directly correlates with outcomes. And so a lot of, you'll see, like even we're going to talk about custodial families, but a lot of caregiving to grandchildren is happening actually in informal roles where they do not have legal custody, which is a lot of times people prefer that so that the parents don't feel like they're giving up custody completely. However, that results in less psychosocial support and less financial assistance compared to the custodial grandparents. So it compounds the challenges for them. So right now, in 2022, based on the American Community Survey, 1.2% of the families were living with a grandparent. Many of them, 2 million of them, had grandparent householder was responsible for their own grandchildren under 18 years of age. Sorry, that house is covering, it's under 18 years of age. And 998,000 families were where there was no parent present, and they estimated their margin of error is about 20 to 25,000, but it's not like 100,000 margin of error. 72% of these grandparents were caring for a child with at least one trauma exposure. And families with disproportionately higher rates of custodial grandparenting include African American families, American Indians, and Alaska Natives, and families where there's lower income as well. And this. Okay. So before we kind of go into challenges, it's important to identify like strengths, right? Grandparents taking care of grandchildren, there can be lots of strengths and lots of good things that can come out of it. So there's the potential for stability, both for the grandchild and the grandparent, that can come out of living in that grandfamily situation. Over time, there can be a sense of positive well-being. It can help them with their cultural identity and belonging as well. Their grandparents can feel more resilient, and it can contribute towards resilience of the grandparents. They can develop a close emotional bond. There's an opportunity for social connectedness between the two of them. For the grandparents, it is an opportunity to find new purpose as well. And when they've done research, they've kind of found in a survey for grandparents, many of them actually would want to do it again, to take care of their grandchildren again. One thing to kind of think about is Goodman and Rao did a study, and they found that 83% of children raised by a grandparent reported feeling emotionally close to their caregiving grandparent, but the emotional and behavioral difficulties or challenges children were facing, in addition to stress, can interrupt these feelings of closeness. So if the child is having emotional and behavioral challenges, that can interrupt and interfere with this closeness to develop. And so then this kind of cycle can develop where it can affect, that stress can affect how responsive the caregiving grandparent is, which can then affect kind of how emotionally close the child feels and whether there are more behavioral challenges. So it can lead to kind of like a vicious cycle developing as well. Some trends are that the intensity of giving has an impact on health and well-being of grandparent caregivers, which can vary by race and ethnicity, like Dr. Ratnakaran was saying, so varies by gender. Both primary and supplemental caregivers have reported higher levels of anxiety and depression. Primary caregivers, compared to supplementals, who are like kind of adding on, have more perceived caregiver stress and have less social support. And custodial grandparents, or who have primary legal custody, compared to occasional caregivers or non-caregivers, were most likely to demonstrate a slower decline in cognitive function over time. And you were wondering like whether they have cognitive limitations as well. And so custodial grandparents were likely to have less cognitive decline over the years. They would report to be more active, but themselves report that they perceive their health to be lower and report higher psychological distress. And compared to non-caregivers, Chinese American custodial grandparents reported fewer mental health problems, but a lower quality of life from the stress of caregiving. They also reported, this is a repeat. My apologies. African American grandparents who were caregivers demonstrated more physical health problems and had a higher mortality risk. And then how it could kind of translate is that kids can be more worried about losing their grandparent as well when they come to see. And African American custodial or primary caregivers were more likely to demonstrate clinical levels of depression, poor physical health, but they reported better perceived health and quality of life, which if you compare to Chinese Americans, it's a little bit different based on ethnicity. Some of the challenges that they face is that, when you're working with grandfamilies and grandparents, no two situations may be alike. Two grandparents taking care of grandchildren in a custodial role may have very different family life and very different emotional life, and understanding of what their experience is like is important. So usually negative outcomes are correlated if stress exceeds their coping and problem solving, and so it's important to kind of ask that in clinical encounters with them. Asking about, how were they ready? What was their perception of readiness? A lot of times these custodial arrangements do not come about over years and years of kind of planning. It can happen when something suddenly happens. Custody may be removed from the parent and given to the grandparents. There could be sudden demise of a parent and grandparents can become involved. So perception of readiness, of how ready they feel to take that on. There could be less structural supports available, again, depending on whether they take full custody or they want to maintain informal custody for some time. And then how does it affect the relationship with other family members? A lot of times grandparents, when they are given legal custody, or sometimes grandparents may have been the ones to call CPS when something is happening and they're concerned. That may not be an easy decision to make, and it can affect their relationship with other family members both ways. One thing Dr. Ratnakaran mentioned was that some of them may feel like guilt if they're not taking up custody, but some of them may also feel like other family members can also blame them for kind of, dividing the family or calling child protective services, even if it was very, very founded. And so it can affect their own supports. Like, for example, like a maternal aunt of the child who was very close to the grandmother now blames the grandmother for the custody of the child being removed, may affect their own social supports. And if that was the daughter who would take her to appointments, now she's kind of lost a big support that she had. And it can also become a tug of war between the parent and the grandparent. So understanding what that relationship looks like is also important. And that, the role changes, their roles have changed, and so the idea of family has been redefined for them, and so that's also important to outline and understand with them. This may also result in limited time with their significant other, and it also is important to kind of ask about, is there marital conflict or is there relationship stress coming from that for the grandparent as well, and could lead to social isolation as well. The other point to also think about is like children themselves may have struggled with, we talked about like 72% of these families, children have at least one trauma exposure. So children could have struggled with neglect, they may have difficulty with attachment, they may have also seen parental substance use, because states that have higher rates of grand families are also where opioid prescribing rates were higher, and also in living in rural areas. So that's also like that stress kind of can get compounded as well. Other challenges, so we talked about like how their role changes and their support may be different. So grandparents may have peers that are age-based, but they may not have the same role. So if they have an age-based peer who understands kind of, or who can relate to and empathize with the physical limitations that age is bringing on, but they may not be able to relate to the role that they have now taking care of a grandchild. And then they may have peers who are role-based, which are so parents who are raising kids, but then they may not be able to relate to the age-based limitations or challenges that they're facing. So they may feel like it's hard to be understood or relate. You can also experience economic hardships, including lost wages, by having to sort of think about working, caregiving at the expense of working. And then it can become harder to advocate and access educational and health services for the child. If they don't have legal custody, it gets much harder. But even for custodial grandparents, it can get hard because things are evolving, the laws will be changing. And so kind of keeping up with it can be a little bit different for different families. And advocating is hard, again, because of the changing landscape and understanding the role and navigation of system. And then a lot of times, like they might be parenting for a second time. And so guidelines and parenting strategies and best practices may look very different. And so where are they anticipating getting support and guidance from versus how do they feel about that as well? And then there can be a stigma of others' view of them as well. That, it happened, like what did they do to their kids? That's why their kids are not being able to take care of their own kids and they have, custody. So there can be like layers of compounded stress and stigma and perception for them too. And so working on these can buffer and create resilience and lead to better outcomes as well. So, but in order to do that, you first have to identify the challenges that they're experiencing. Just additional considerations. Those of you who have worked with me know that I talk about Ericksonian stages a lot. So just in terms of like the stages of development of man, grandparents are more likely to be in the zone where Erikson, who is a developmental theorist, talked about having kind of dealing with integrity versus despair, looking back at your life, thinking kind of like, what has happened, where you've come, what kind of legacy are you leaving behind, etc. And so this could be both like if navigated well, could lead to like a lot of wisdom, could develop virtue of wisdom, but a lot of times if grandparents are looking back on their lives and sort of they can also start to feel a little bit of despair or start to feel, some stress or depressive thoughts based on that to kind of looking back at their life and kind of seeing where the role and stage of life they're in right now. It's important to also ask, again, the circumstances in which the custodial arrangement happened, the age of the child at the time of the custodial arrangement, and what was their relationship life like. If the grandparent was never involved in their life and suddenly they came and they saw something and they called CPS and now the kid is removed, the grandchild may blame the parent, but if the grandparent was the one who the kid was confiding in before, had a very strong relationship, outcomes would look very different in that situation. And then parental and child response to the transition and beliefs and understanding, as well as openness to more support. So what is their belief about like getting help and support for parenting versus do they want to do it alone? And what is their openness towards getting more support? So self-report data confirm that custodial grandparents engage in both effective, like giving rewards and monitoring, and they also engage in ineffective parenting practices like harsh and inconsistent discipline or having difficulty with limit setting. So kind of understanding what their openness for support might look like is important. Transitioning support. So it's important to take care of yourself as a caregiver. So when you talk with grandparents who come into clinic, or at the hospital, bringing their grandchildren, it's important to kind of ask them what are they doing to take care of themselves. I mean, there's limited times, but it is important for them to do some of these things, to take care of themselves, and because it can lower your stress and boost your mood. And then also kind of asking about what are other supports what do other supports look like for them? Are there any additional family members who can help? Are there any gender-based considerations that you may need to make? Is social services still involved? Or was there a social services navigator or case manager that has helped them in the past that they could reach out to? What is the school situation like? Schools can also be helpful in providing support. They can have sometimes some schools in some regions, I don't think Roanoke has that, can have like support programs for grandparents specifically where they can have like help them understand like the changing landscape of the educational system. And then schools overall also celebrate, Grandparent Day at times and to celebrate grandparents as well. Are they, again, this is where you can refer them for parenting classes or parenting programs, but this is where their openness to support may kind of come in, and so you may have to work through that. There's a grandparent triple P, so the triple P is positive parenting programming, which is a 9-week program, which is 6 group sessions, 3 telephone consultations, and when they kind of applied this triple P program to grandparents, they found that grandparents found it both acceptable and useful. Are there any other supports that could exist? Are there any in-care service providers in their area who can provide some support? Dr. Ratnakaran mentioned like support groups. So are there support groups that they could participate in? Do they have a case manager or case management involved? And then what is physical and digital programs can also be helpful. So kinship navigators, these kinship care service providers, can also help with SNAP benefits, with applying for Medicaid, with child care, and for providing parent services as well. And I'll talk about some of the support groups in the online resources. Other supports, so financial supports, they may require going to the Department of Child Care Service, the Child Services, to get some financial assistance as well. Do they need legal supports and legal services? Do they need to get a lawyer to look through and make sure that the custodial arrangements are accurate? Because sometimes it may have been given to them for a little bit for custody for some time, and then if the parent is coming back and saying that, I want to get custody back, do they need legal services for that aspect as well? And so the role of the therapist, is there a role a therapist can play? Do they need family support? Do they need family therapy? Is there a role? Do they have a psychiatrist? Is there a role the psychiatrist both for the child as well as for the grandparent can play? And how can you help? And these can help bolster that dyadic relationship, the relationship between the grandparent and the grandchild. Other things that have been helpful have been, and again, these are roles that therapists can play, that resourcefulness training, which is like CBT or cognitive behavioral intervention, to help facilitate the development of social and personal resourcefulness skills, so like seeking help or accessing self-help resources, have helped in mental health outcomes for recipients. So what role can physicians play? No matter where in the healthcare system they come in contact with a physician or healthcare provider, first of all is to identify a challenge, what level or where is the challenge that they're facing, and then screening for difficulties related to the custodial role, and then navigation and referral for these resources. And it's important to kind of talk about and educate them on the resources that might be existing. Referral for therapy services if the family needs it and the child needs it, but also in addition to child, think about the family unit. Do they need therapy and services in the family as well? And coordination of care. Do they need a case manager? Does somebody need to really help them coordinate care for them? And then your role is to advocate for more services and more and to advocate for them as a family as well. The only other thing to think about, as you're advocating and coordinating care, is remember we talked about what were the circumstances in which they came to have custody. So if there's a component of grief in there, if there's a component of parental loss in there as well, do we need to evaluate for grief therapy as well and refer them for grief therapy too? And then, okay, so there are national programs that can be helpful. So there's a National Family Caregiver Support Program that was started in 2000 to help enhance the state's abilities to provide comprehensive services to grand families. And so these are programs that are designed for people who are over the age of 55, but they're caring for those under 18. So this would be where grand families would come in. And then there's been expansion of programs, for example, Social Security income, to provide services to those that are under 18 as well. And so letting the grandparents know about that, especially if the challenge that they're facing is financial. Other resources and online resources that can be accessed. So there are grandfamilies.org has a lot of good resources, as well as a grandfacts fact sheet. There's a Brookdale Foundation group that talks about and has a relatives as parents program that can be helpful for training and resources. There's a National Institute of Aging, which has a guide for grandfamilies and kinship families and how do you care for young relatives. The Grand Family State Law and Policy Center is helpful in terms of what different states have to offer and what their laws look like, because again, it would look very different in different states. And then Child Welfare Information Gateway has resources for kinship care. The Kinship Navigator is a website that is again by states, and it's by the Grand Families and Kinship Support Network, and it'll help you find a navigator and support person as well in the area. And then these are their websites as well. So the other organizations that can be helpful for resource provision for grandparents can be the American Association for Retired Persons, which has a Grand Families Guide. The website is there. Generations United, which is a national center on grand families. This is a national membership organization dedicated to improving the lives of children, youth, and older people through intergenerational strategies, programs, and public policies. So that would be a good resource to have as well. And then we talked about the Brookdale Foundation and Grand Family Resource Center. And then there's the North American Council on Adoptable Children that can also provide them support. So in summary, the challenges that the grand families face and grandparents face are unique. Even if the custody situation looks the same for two different grandparents, their challenges might be unique, so it's important to identify those. Outcomes are important to consider, and support is important to identify. Support is important to provide better outcomes, and then physicians can help identify these challenges. And please think about referring to supportive programs when you come in contact with grandparents who are raising grandchildren. And your role as don't forget your role as advocates for them. So the references. Thoughts? Questions?
Yeah, and I apologize if this is outside the scope of this presentation, because I know we're focusing a lot on the grandparents, but as pediatricians, I do just wonder, like, is there any data showing, like, with these support groups, are there any difference in outcomes for the children themselves?
Yes.
Okay, so.
There's better outcomes for the children. So as you, for example, as you help, as the children feel connected to the grandparents or to the person in a parental role, if the emotional bonding getting stronger and the dyadic relationship getting stronger can lead to better emotional outcomes for them. If we already know that by advocating for more supports during school, you can help improve educational outcomes. So like talking to the grandparents about if the child has a physical illness as well, like is there a 504 plan that's involved? Do they have an IEP? Does the grandparent know how to ask for an IEP? Do they know how to write a letter for that? Do they know that the school will have 60 days to do testing to kind of then provide resources? So giving them that education will improve educational outcomes for the child, improving, longer term outcomes for them as well. So yes, it will, providing support for grandparents will ultimately lead to better outcomes for all of them. Good question.
Yeah, I have a question. Can you hear me okay? This is
Yes.
Dr. Hart. Yeah, I just wanted to thank you for scheduling this topic on grandmas. It's very personal to my wife and me. My wife and I adopted our 14-year-old granddaughter at age 15 months due to severe mental illness, drug and alcohol use in her parents. And we had to proactively push through the legal system financially to make this happen. It was a very big financial burden. We had to go through the whole process of hiring a lawyer, confrontational with the parents and so forth. Although I retired from clinical medicine 5 years ago, my clinic when I practiced had probably 10 to 15% of my patients being raised by grandparents. In addition to the racial and ethnic differences you pointed out in this presentation, I do want to point out that children with chronic illnesses have parents with higher divorce rates and are more likely to have custodial grandparents, in addition to the racial and ethnic differences. From a financial perspective, it's important for the trainees to realize that, because this is something that we were unaware of, retirees who are adoptive grandparents can actually, once they start receiving Social Security, their grandchild receives 50% of the amount of their Social Security until that grandchild is 18. And almost every grandparent was unaware of that. Also in Virginia, Virginia automatically covers adopted children through Medicaid, and most parents didn't know that either. And not all states do this. We moved to South Carolina for a couple of years, and they did not have that policy. So we had to purchase, with a significant amount of money, insurance, catastrophic insurance for our granddaughter. Essentially, we didn't cover any general service. So all the stuff medical-wise, we paid out of pocket on a fixed income. So that's another important factor. Virginia is really outstanding in that category. Often parents are reluctant to release custody to the grandparent, even in the case of incompetence or addicted parents. And this is a huge problem in my clinic. So we need to reinforce the fact that grandparents may need to pursue legal options for the adoption, even sometimes puts them in a confrontational role with their children. But social services, as you point out, can really help this. it's well worth it. And I just want to reiterate that this is such a great, important topic, and thank you to the planners for putting this on.
Thank you for those comments, Edward.
I'm not going to add to that. I was just going to say that because that was, I appreciate it, just like he said, I appreciate your bringing this because we see this so much and good to be thinking about what they're going through and stuff. I was just going to say that I would think that as a parent, as a grandparent, your tendency is to indulge and to parent and not want to parent as much as support the child. And then when you flip over into the custodial role, that you now have to sort of change gears and it makes it difficult. You want to be a grandparent and indulge. So I have seen, particularly teens that have come in, that the grandparent really has almost like a laissez-faire kind of approach to parenting. And I see the kids sort of kind of running amok a little bit. Not true with Dr. Hart, but in many, in some situations I do see that, and I can see that being a challenge for them to kind of shift gears.
I think that's absolutely accurate, because I think we talked about like what is the relationship of the grandchild and the grandparent before a custodial arrangement happens, and then you transition, and now you've gone from like being that grandparent who sort of is indulging and kind of just letting just, I don't want to use the word spoiled, but just kind of helping them do what they want to do and taking care of them. And now your role kind of changes, and so that role-based transition can be stressful both for the child and for the grandparent as well, because you have to. It's a new perspective and a new lens to look through. Plus, there may also be feelings of again, you have that love for that grandchild, sort of thinking that if limits need to be placed, or like different placement options are needing to be pursued, there could be like thoughts of, I don't want to abandon my child or my grandchild, so much has already happened. And so there could be all these sort of like feelings that you have to kind of outline and think about and create like a lot of challenges for them, because limit setting can be difficult in those situations as well. Yeah.
Is family-based counseling the best way to go about that, or what would be the best thing to recommend? Because I've even seen it where like they'll start resenting the grandparents just because they've switched that role. They're going, well, you were doting on me and buying me all this stuff. Now you're disciplining me. You're taking things away, and they don't like that transition.
I think that's the word I was looking for. It's just funny. Thank you. So it depends. It depends on the age of the child. It depends on what the specific kind of concern that they're coming in with. So, for example, if the child is young, you could think about do the grandparents need to do like some parent-child interaction therapy with the grandparent? Would they benefit from parenting programs? Like again, the triple P program, the positive parenting program, has been adapted for grandparents as well and has shown good outcomes, and grandparents have found it to be supportive as well. If they're older or there's a lot of conflict that's in the family, even so, family-based therapy can be family therapy can be really helpful. Also in situations where the parent is still present, it could be a thought to consider, like the parent can be invited as well, just so that that this family unit can become more effective for them. Because the other thing to think about is also like the grandparent could have custody, but how is the parent still involved? Is there the parent still involved? A lot of times as parents are recovering, they will choose to move into the grandparent's house as well. And now you've got like the parent is present, the grandparent is trying to, parent the child, and then there can lead to a lot of conflict between all of them. Whether it was the grandparent who called Child Protective Services or not, it can create a lot of tension and triangulation between the three, assuming there's one grandchild, one parent, and one grandparent. So
the part of that is the generational beliefs too is also very important here, because the grandparent is probably mimicking how I raised my actual child and how I was raised. And with the current advent of social media and everything going on, they'll find that raising a grandchild right now is totally different from how they raised their child and how they were raised, and that they might not be educated, they might not be aware of a lot of things. Are they overdoing it or not underdoing it? It's something you have to figure out for them. A lot of grandparents talk about social media and gadgets and stuff like that, not interacting, which can be valid a lot of times, but also it's an expectation that this is the current generation. So what's the current generation right now? It's probably an education for the grandparents too, that how do you address the beliefs and how do you meet expectations?
I think also like when you're saying that, helping the social media aspect with grandparents, I think that that's very true because grandparents like need appreciating and understanding what all is out there. I mean, like how to keep kids safe from social media, but also they might be the ones who are helping them navigate some of that technology as well. I remember like a couple of times when we moved into the pandemic and there was a lot of like televisits going on, the families which were grand families, a lot of times the kids themselves were helping them navigate, here's how you log online to get to your appointment or to get to my appointment. And so kind of understanding that, well, especially as you're doing video visits and anything, like if you're recommending like apps to help them monitor like the child's phone use and stuff, how comfortable do they feel with that is also important. Or if you're saying like, okay, your transportation issues was one of the challenge identified. If in order to counter that transportation challenge, you say, okay, let's do a video visit, but then like, are they able to log on to do that video visit? What does internet look like where they are is also like important aspects to consider.
Thank you so much.